Hello everyone, my name is Amanda, this is Cynthia. We're here from West Coast University to teach you about anaphylactic shock and the use of the Epipen. Anaphylactic shock is an acute hypersensitive reaction to a sensitizing substance or allergen which causes respiratory distress and can sometimes be life-threatening. Common triggers for anaphylaxis include certain medications such as penicillin, insect stings, foods such as tree nuts, shellfish, milk, and eggs, agents used in immunotherapy, latex, and in some cases exercise such as running can trigger anaphylaxis. Risk factors for severe anaphylaxis include a previous anaphylactic reaction, allergies or asthma, a family history of anaphylaxis. What are the complications of anaphylactic shock? Anaphylactic shock is extremely serious. It can block your airways and prevent you from breathing. It can also stop your heart. This is due to the decrease in blood pressure that prevents the heart from receiving oxygen. Some complications include brain damage, kidney failure, cardiogenic shock, arrhythmias in the heart, either too fast or too slow, heart attacks, and even death. The first step for treating anaphylactic shock will likely be injecting epinephrine, which is also known as adrenaline, immediately. This can reduce the severity of the allergic reaction. At the hospital, you may receive cortisone and antihistamines intravenously. These help reduce inflammation in the air passages, improving the ability to breathe. Your doctor may give you beta agonists such as albuterol to make breathing easier. You may also receive supplemental oxygen to help your body get the oxygen that it needs.
Okay. Okay, so now I'm going to be talking about the administration of the Epipen. So an Epipen is an epinephrine injection. It's also known as adrenaline. How does epinephrine work during a life-threatening allergic reaction? It constricts blood vessels to increase blood pressure. It relaxes smooth muscles in the lungs to reduce wheezing and improve breathing. It stimulates the heart and increases heart rate. And it works to reduce hives and swelling that may occur around the face and the lips. When should an Epipen be used? Antihistamines are commonly used for treating hives and other skin symptoms, but they do not treat the life-threatening symptoms of anaphylaxis. According to the National Food Allergy Guidelines, epinephrine is the only recommended first-line treatment for anaphylaxis. Anaphylaxis is a severe and potentially life-threatening allergic reaction that occurs very quickly, even as fast within a couple of minutes of exposure to an allergen. As soon as the symptoms of anaphylaxis begin to show, the Epipen should be administered. So these are some of the symptoms that you can feel in different areas. So as far as the head, feeling very anxious, confusion, dizziness, and passing out. In the mouth, you'll feel itching, swelling of lips and or the tongue, tingling of lips or tongue. In the lungs, you'll experience a shortness of breath, coughing, wheezing, difficulty breathing. As far as the skin, you'll experience itchiness, hives, redness, and swelling. In the throat, you would experience itching, tightness, or closure, coughing, and hoarseness. In the heart, you would have a weak pulse, fast heartbeat, and also shock. And then in the stomach, you would experience vomiting, nausea, diarrhea, and cramps. So how to administer an Epipen? So this is actually an Epipen. So what you would do first is you would remove the blue cap, which is the top. Then you would swing your arm and you would administer it to the outer thigh. You would hold it there for 10 seconds to make sure that all of the epinephrine is administered. And then after it's already administered, you would take it out. What are the side effects of epinephrine? Side effects of the Epipen include upset stomach, nausea, dizziness, vomiting, weakness, sweating, pale skin, tremors, shaking hands that are non-controllable, nervousness, headache, and anxiety. So now I'm actually going to pass the Epipen around and I want you all to practice administering it, okay?
I have a question.
Yes.
After you apply the Epipen, how do you dispose of it?
So basically what would happen after having an anaphylactic shock, you would basically call 911 and the person would go to the hospital. After they're already in the ER would dispose of it.
Okay, so.
I'm sorry to bother. I have another question. Does it expire?
Yes, it does. So you have to make sure that it's not expired before you administer it.
Okay.
Can we use it in kids?
Yes, there is actually a junior size Epipen.
Can you inject it over clothes?
Yes, you can. Any other questions?
No, that's it.
Okay, thank you, class.
Viewer discretion is advised.
Hey, how's it going, Diana?
Hey, how are
doing
you,
today?
Nando? Good, and you?
How's everything?
Good, good.
Studying
You're
for
studying?
class?
Yeah, for cannabis final.
How's that
You?
going?
Good, good.
Yeah, I'm studying for the final too. Right now, just came out from Open Lab.
Oh,
I did my
okay.
12 hours for the week, so
That's
I see
good.
that you're studying.
Did you go to lunch already?
Yeah,
I'm
I
hungry.
already had lunch, but actually I had a snack that I didn't eat, so
Yeah?
I brought with me.
Oh, that would be
In case
nice.
you want to have it.
Oh, thank you so much.
All right, those are really good M&Ms. Do you like M&Ms?
Yeah, yeah, I do.
You know, give them a try, see if
Thank
you
you
like
so
them.
much.
I always have them for lunch. It shows that, you know, today I was already full.
So how's clinical?
Clinical's going good so far. So looking forward for next semester. Are you stressed or something?
Yeah, I'm a little nervous.
You don't have to be nervous, you know. Everything's gonna be worked out. Are you okay? Wait, are you allergic to peanuts? Oh my. I think she's going to an anaphylactic shock. I think I have an Epipen here. Let me check. Clear? Are you okay? Is everything fine? Can you breathe? I think you just had an anaphylactic shock. It's a allergy reaction to peanuts. So I guess we're gonna have to call 911 to check for your vitals, all right?